The type of pathogen that causes anthrax is Bacillus anthracis, which is a bacterium. Bacillus is a genus of gram-positive rod-shaped bacteria and a member of the phylum Bacillota with 266 named species. The size of Bacillus anthracis spore is 1 to 1.5 times 3 to 10 micrometers. Anthrax is usually spread in the form of a spore and is generally spread in one of three ways. The first way is skin. When bacteria enters a skin cut or scratch, an infection develops. The next is inhalation. Some anthrax infections occur when people breathe in the spores of the bacteria. The last is gastrointestinal. Some people may get anthrax by eating infected meat that has not been properly cooked. Pass from one person to another. Even if you experience inhalation anthrax symptoms, you will not spread to other people. The risk of infection to others through drainage from an open sore if you get cutaneous anthrax is minimal. The only direct contact with the drainage from an open sore can spread cutaneous anthrax. For skin anthrax, the symptoms are a collection of tiny lumps or blisters that may itch. After the little blisters or bumps, a painless skin sore with a black core will form. The sore will typically be on the face, neck, arms, or hands. For inhalation anthrax, the symptoms are fever and chills, chest discomfort, shortness of breath, confusion or dizziness, coughing, nausea, vomiting, pains, headaches, sweat, extreme tiredness. For intestinal anthrax, the symptoms are chills and a fever, neck or neck gland swelling, swallowing pain, unwell throat, nausea and vomiting, bloody diarrhea, headache, red eyes and flushing, abdominal pain, and fainting. Three groups of persons aged between 18 and 65 who may be in danger of coming into contact with anthrax due to their job can utilize the anthrax vaccine. These groups should receive 5 doses of anthrax vaccine spaced out over a period of 18 months in order to develop immunity. These at-risk adults who receive the vaccine before exposure are certain laboratory workers who work with anthrax, some people who handle animals, or some members of the military. People who have been exposed to anthrax but have not yet displayed any symptoms can avoid contracting it by taking antibiotics. Antibiotics work in two ways, by killing anthrax and by stopping it from growing. When anthrax can't grow anymore, it dies. The following are two examples of antibiotics that may be used to stop anthrax: doxepin and ciprofloxacin. Anthrax spores can become active once they enter the body. When they become active, anthrax bacteria can multiply, spread out in the body, and produce toxins or poisons. Anthrax toxins in the body can cause severe illness. Antitoxin is one of the potential treatments for anthrax toxins after they've been released in the body. Doctors must use antitoxin together with other treatment options to treat the patient. Antibiotics, including intravenous antibiotics, can be used to treat all forms of anthrax infection. To have the best chance of making a full recovery, it's critical to seek medical attention as soon as possible if someone exhibits anthrax symptoms.